Hello everyone, my name is Gardenia Garcia and for my crime intelligence analysis portfolio, I'll be talking about fentanyl and opioid overdoses. So for my introduction, I will be going ahead and providing you with a brief background and a little introductory as to what fentanyl is. So in particular, fentanyl is a synthetic opioid that is described to be 50 times stronger than heroin. This substance can be found in several forms. For example, it can be found in pills, powder, and liquid. Fentanyl is consumed via snorting, sniffing, smoking, orally taken by pill or tablet, or in some cases, it could even be applied to the skin via a patch or mixed substance pills. People can access fentanyl from a doctor who then prescribes their patient with pharmaceutical fentanyl to treat chronic to severe pain. In many instances, the prescription is prescribed as a patch or as a small medical tablet. However, this has become a health risk factor given the potential addictive dependency that fentanyl has. Those who are using fentanyl as a medical prescription can experience withdrawal symptoms when the drug is stalled because it is no longer needed. Some of the common symptoms people experience are muscle and bone pain, sleeping problems, vomiting, diarrhea, and cold flashes and goosebumps. In addition, the high dependency on fentanyl causes substance use disorder, which is SUD, which is defined as compulsive drug seeking. As a result, it becomes difficult for users to regulate themselves from fentanyl and stop dependency once medical clearance is advised. People who are addicted to fentanyl can experience their dependency from a mild standpoint to a severe standpoint. Although medical professionals are required to advise their patients of the risk factors, some patients ignore the risk factors to help them cope with their day-to-day lives. In addition, the illegal distribution of fentanyl is accessible via street distribution organization, and it is sold in the form of powder, put in the eye drops, drops of blotted paper, nasal spray, and pill substance form. So for my project, I went ahead and used three analytic techniques. The first analytic technique used was starbursting. Starbursting is a brainstorming process that assists crime intelligence analysis and exploring solutions by asking questions that help in strategically planning and implementing their ideas. Starbursting concentrates on raising questions rather than looking at solutions. In addition, Starbursting embodies six elements of questions, which are the who, what, where, why, and how, which is represented on the right-hand side given the image. In addition, in this case, analysts are prompted to derive as many questions as possible related to the topic at hand. The purpose of this is to allow the analyst to identify as many questions as possible to identify any research gaps. So for instance, for mine, for the what, I have what is fentanyl and its harmful effects. What policies address fentanyl crisis? What demographic is pre-exposed to fentanyl? For the where section, I have where are fentanyl overdose occurring? Where are people obtaining opioids? Where is the epicenter of the crisis? How are people affected by fentanyl? How many have died or been saved by Naxon? Naxon is a medication that reduces in overdoses. How are first responders and police officers trained to handle overdoses? For the why, I go ahead and have why do individuals consume opioids? Why does fentanyl addiction persist over long periods? Why is understanding consumers' motivation important for law enforcement? For when did fentanyl overdoses become an epidemic? When when are different demographics most at risk? When are individuals likely to consume fentanyl? And for the who is involved in fentanyl overdoses? Who are the key players at risk? And who are the distributors and putting community members at risk? Following the list of each question for every point, they can either be grouped or given priority, thus utilizing prioritization to highlight the questions most valuable to law enforcement professionals and agencies or departments. For my second analytic technique, I went ahead and chose key assumption check. Key assumption check is a systemic effort that aids in questioning the analyst's assumption and influences their decision and the analyst's interpretation of a given solution. This method is widely used in the intelligence field since analysts frequently deal with erroneous or missing data. Thus, by using key assumption check, analysts can critically examine their assumptions and evaluate if their assumptions are valid, as well as evaluate if their analyst has any limitations. In the key assumption check, it is important to come up with a face valid analysis to establish the validity of the concept claiming to be measured. As such, it is crucial to list all the stated and unstated assumptions that are true for the analyst to be valid, for the analysis to be valid. So for my assumptions, for the first assumption I have is illicit manufacturing of fentanyl play a key role in the accessibility and rise in fentanyl overdoses. For the second key assumption is that people abuse their medical prescription of opioids. Opioids have become a major risk factor in neighborhoods as there have been illicit distribution of fentanyl disrupting communities. And last but not least, the third assumption is the evasion of law enforcement not being fully knowledgeable in how to disrupt illicit manufacturers and remove harsh substances off the streets. Moving right along for my last analytic technique, I went ahead and used the IZE method. The IZE method is useful because it allows analysts to inspect the data in detail and find new insight. So for mine, the IZE method consisted of 5 little components. 1 is categorize, 2 generalize, 3 organize, 4 minimize, and 5 maximize. Through the IZE method, trends and patterns such as yearly and age-specific data are better understood. This methodological approach facilitates a detailed understanding of the impact of drug overdoses over the year. In particular, I would like to go ahead and highlight that for the categorize, it was an important process because it enabled the researchers to categorically identify drug types associated with overdose death across various demographics, including age, gender, race, providing a structured overview of the data set. In addition, for generalize, it was important because this enhances the dataset usability for public health insight and other applications. For the third one, for organize, it details statistical and data analysis map the trajectory of the crisis and identify pattern over time, which is important to know. For my fourth one, for minimize, it focuses on specific data attributes such as years and indicators related to drug type. The researchers minimize extraneous information. It simplifies the dataset, allowing for a macro level view of overdoses, death rates, and the factors influencing these trends, which show more profound insight by race, gender, and location. Last but not least, for maximize this step leverages the refined data set to provide actionable insight into the drug overdose crisis. So for my data and method, I would like to indicate that this report uses comprehensive data set from 3 principal sources, each contributing insight into the trends and specific of drug overdose death across the US. And the exploring drug overdose death rate in the US dataset from 1999 through 2018. This dataset provided detailed data on overdose death categorized by drug, type, age, sex, race, Hispanic origin, capturing the broad evolution of the epidemic over 2 decades. In addition, the Health and Human Services, HHS, data on suicide death rates is used to gather mortality data related to substance abuse and mental health disorders, combining deaths associated with drug overdoses. Last but not least, the third source, the Center for Disease Control, CDC data, shows specific and up-to-date detail on opioid-related deaths with a focus on various types of opioids, including prescription, drugs, heroin, and synthetic opioids such as fentanyl. So for my results and finding, I would like to mention that statistical analysis shows that drug overdoses death increased from approximately 16,849 in 1999 to over 70,000 in 2017, marking an over a 300% increase over the period. The increase was relatively stable until the year 2010. In this case, looking at the yearly changes, the year-over-year increase peaked in 2017, 7 years. The finding shows that fentanyl, through an analysis of each drug by category, has the highest and most significant number, surpassing all other opioids. In addition, prescription opioid deaths peaked in 2010 with 16,651 deaths, but began to decline to 14,975 by 2018 due to the enhanced regulation and monitoring. Synthetic opioids such as fentanyl showed the most significant rise in observed death related directly to fentanyl, skyrocketing from 5,544 in 2013 to a little bit over 28,000 deaths in 2017. Last but not least, in 2018, this accounted for nearly 60% of all opioid-related overdose deaths. For my continuation of results and finding, I would like to demonstrate here the demographics broken of overdose death. If you could see here, there is three different categories for the year of 1999. There is a primary group of the ages of 15 through 24, 1999, 25 through 44, of ages, and then 1999, 46 to 64 years of age. And each one of these changed significantly over the age group and over time, because if you compare the first two sections, you see for 1999, 2018, there was a total that's of 1,432 to 5,000. So it increased by 5 times. And then for the age group of 25 to 44, for the year of 1999 and 2018, it originally started from 11,537 deaths, and it went all the way up to 35,410 deaths. And for the older group age from 1999, from 45 to 64, the original overdose deaths was 3,242. But in 2018, that same exact age group of years, it went up to 29,725 at a significant rate. In addition, if you look over to your right-hand side, Table 4, state-specific overdose death rates indicate the significant amount of overdose deaths per 100,000. To conclude, within my presentation, the three analytic techniques were used to analyze a data set about drug overdose death rates by drug type, sex, age, race, and Hispanic origin in the US. These techniques were important because they allowed us to have a more better understandings of crime intelligence and the reason as to why fentanyl is a huge epicenter. Being able to identify any patterns can help deter fentanyl overdoses, as agencies will be more aware of any key points to dismantle and disorganize these street disruptors. In addition, new strategies should arise to combat the epicenter of opioid overdoses to protect the public at large. Last but not least, this will help law enforcement agencies prevent further crimes from arising from this issue and better prepare for future criminal activities or to help stop any future activities from occurring. The limitations on future research consists of excessive potency and toxicity in fentanyl, law enforcement organizations controlling the illegal drug trade and stopping the spread of drugs laced with fentanyl presents formidable obstacles. In addition, coordinated efforts between local, national, and international law enforcement organizations are necessary to disrupt these trafficking networks and to keep our community safe. Community relations may be impacted by drug enforcement policing tactics, particularly those that deal with opioid usage and overdoses. Specialized instructions and training are necessary for law enforcement personnel to properly identify, handle, and dispose of fentanyl and fentanyl-laced drugs. To address these issues, a multifaceted strategy involving cooperations between law enforcement agencies, public health authorities, community organization, lawmakers, and stakeholders is essential. That concludes my presentation, and this is just a brief, detailed explanation of the references that were used. Thank you. I hope you enjoy my presentation.